Good evening, ladies and gentlemen. Today is October 13th, 2020. Welcome to the Voice of the Go Media TNT Daily News. This is Alex. Please like, share, and subscribe our channel. We would like to hear valuable feedback from you. So let's jump into today's daily news directly. Some advanced economies, including the United States, Australia, and Japan, have said COVID-19 vaccines they buy, provided they have been proven safe and effective, will be made available to their citizens for free. However, the second largest economy, China, their National Healthcare Security Administration on Friday said the medical insurance system could not afford the high cost of the vaccinating the population. This just another proven point that shows how much the Chinese Communist Party care about their own people. So let's get more details from a reporter.
On October the 12th, the Beijing Evening News published a proposal by the National People's Congress to include the vaccine of COVID-19 into social medical insurance for full reimbursement. It mentioned that it would be free for all Chinese people to get the COVID-19 vaccine. However, the National Healthcare Security Administration of China made an excuse that the COVID-19 vaccine is a preventative vaccine that it should not be included in the scope of the social medical insurance policy. Meanwhile, considering a large number of vaccinated people, they claimed that it could not be afforded. The statement reflected that the Chinese people are the leak to be harvested by the Chinese Communist Party. When the epidemic broke out in China and the world, all governments in the Western world rushed to put additional funds from the government budget to help the victims. The CCP does not want to allocate more funds to the Chinese people. When all countries in the world sent planes to bring their citizens back to their home countries, the CCP ignored the request of the Chinese overseas to return to China on the grounds of preventing the imported virus. When the countries around the world offered the furnished hotels for free to their people for quarantine, the CCP charged high fees. While Xi is trying to rub off the last penny of the Chinese people, he fabricated an image of his generosity to the world. At the 73rd WHO conference, Xi promised that China would provide the vaccine of COVID-19 as a public product of the world. Later, Xi and the other senior officials of the CCP made it clear on various diplomatic occasions that the CCP would prioritize the vaccine supply to developing countries such as Southeast Asia and Africa. The goal of this movement was to bribe countries in the world through vaccine diplomacy and achieve its objective of controlling other countries and confronting the free world such as the United States. For the regime to survive, the CCP gives out vaccines as public product to other countries for free or at low prices. However, it is unwilling to provide free vaccines to its own people.
Thank you very much. Our next news. The coastal Chinese city of Qingdao is testing more than 9 million residents for CCP virus, and there was evidence indicate that the outbreak started even before the Chinese national holiday. The Chinese Communist Party keep lying about the outbreak like always. Let's find out more information about the CCP virus outbreak in Qingdao from our next news.
On October the 11th, Qingdao Municipal Health Commission claimed that 6 COVID-19 cases were found in the city. At the same time, the local government claimed an emergency status. It commanded in a statement that all citizens in Qingdao have to take the COVID-19 test within 5 days, and this meant that about 6 million tests would be performed. Qingdao authorities made a database statement that testing could be done within the 5-day constraint. But according to the video of piling people, it is questionable that the government could finish the testing on time. As large crowds of people gathered, opposite voices against the group testing appeared. People worried that there would be an immense potential spread of the virus as there was no social distancing among the people waiting in line. They claimed that Since there were only several positive cases, it would be much easier for the local government to track their close contacts rather than testing 6 million people in the city. Many people believe that the breakout happened after the CCP's National Day. However, evidence illustrated that government covered up the second wave of COVID-19 before the holidays. A WeChat screenshot displayed an article titled "Don't Travel to Qingdao" was published 10 days before the COVID-19 breakout. The message was meant to inform the employees of a Shanghai hospital to avoid going to Qingdao as there may be cases emerging. It looks like that the authorities knew about the breakout in advance. Many may wonder, why do they do that? Well, one thing that we are sure is the regime wants to pump up its economy through the holidays to show the world that it is still strong. Yet we know that it is still on its way to an end.
Thank you very much. Our next news. Chinese whistleblower Dr. Li Mengyan just published her second scientific report. SARS-CoV-2 is an unrestricted bioweapon. Dr. Yan claimed the Chinese Communist Party intentionally created and unleashed COVID-19 upon the world as part of the biological warfare. She later created a Twitter account to tell her story. However, Twitter immediately shut down her account within 2 days. Let's get more details from our next news.
As the second research paper, SARS-CoV-2 is an unrestricted bioweapon being released by Dr. Yan, more and more people started to believe that the coronavirus was genetically engineered by the Chinese Communist Party. Many of the US top scientists have verified and acknowledged the solid evidence that Dr. Yan and her team proved in the report. Nevertheless, the world's top health institutions such as National Institute of Health, World Health Organization, and Centers for Disease Control and Prevention did not say anything about her study. The director of the WHO, Tedros, even praised China for its handling of the virus. Many had criticized him for being bribed by the Chinese authorities, as news proved China deliberately covered the outbreak of the pandemic when it emerged. Linking the examples of Tedros, it makes people wonder whether the reasons for NIH, WHO, and CDC not responding to her report is due to their political stand. The highly transmitted virus has affected at least 8 million people in the United States, and the authorities must find out their origins, because only if they find out where it started, they could ensure that fewer people will be affected.
Thank you for the reporting. Our last news for today. Doctor from New York, Zulenko, is famous for his treatment of 669 COVID-19 patients with a combination of hydroxychloroquine and a couple other medicines, has seen 0 hospitalizations and complications or deaths. Lately, Dr. Zulenko has joined the actions in the U.S. Supreme Court against Twitter and other social media platforms. Let's find out more from a reporter.
Dr. Zev Zelenko, a family medicine practitioner, has joined several high-profile doctors promoting the use of hydroxychloroquine in a clinical study of outpatients. The doctor is the latest among many doctors challenging the effectiveness of masking and promoting the use of hydroxychloroquine in treating COVID-19. As many so-called dissident doctors reject the hegemonical dismissal of hydroxychloroquine's prophylactic effectiveness, Dr. Zelenko has been publicly humiliated and has had posts removed by Twitter and other social media platforms. Many of these platforms, most notably YouTube, have publicly stated in no uncertain terms their policy of censoring all content that fails to conform to the WHO's stance on all COVID-19 related information. Thus, medical professionals and scientists are limited to remaining mere mouthpieces of an international body with less than the exemplary track record of consistency, transparency, and accountability. Dr. Zelenko has since joined the action in the US Supreme Court against Twitter and other social media platforms.
Thank you for the reporting. Well, ladies and gentlemen, that's all for today's TNT Daily News. Thank you for tuning in. Again, this is Alex. See you next time.